Community College. So she's going to do a little presentation. So we'll just welcome her. Everybody? All right. So go ahead. Do you need any? Perfect.
Okay, so yeah, my name's Caitlin. I'm going to school at VCC to become a dental assistant, and I'm going to be sharing some info with you today. I'll click here. These are some. Okay, so I thought we could start out with some fun facts to start out. In early times, dental problems were considered to be spiritual in nature. And dental care was practiced by magicians and priests. Incantations and spells were placed to cure the tooth of evil spirits. This was usually unsuccessful, and the patient suffered through the discomfort. The great scholar Hippocrates was one of the first to recognize dental disease as a physical rather than spiritual problem. And he developed the first crude dental instruments, which were designed to remove the diseased areas. The design of some of these early instruments is still the basis for some of their modern counterparts. Around the 15th century, in some parts of the world, people began to realize that keeping their teeth clean could reduce dental disease. The same period saw the development of the occupation of barber surgeons, who combined hair cutting and beard trimming with the practice of dental surgery.
Thank you.
During this time, you can have a trim and an extraction at the same appointment. So I wanted to talk about basic oral health care. It's a basic and necessary care for everyone of every age, especially as we age. All of us need to brush up on our mouth care, as our oral health and life depend on it. Modern dentistry's main goal is the prevention of diseases of the mouth. Do you know what the two major diseases occur in humans are? It's dental cavities and periodontal disease, or gum disease. So, a bit louder. So these are some teeth. You can see they're looking pretty sad. They have some sore spots. So dental cavities, or tooth decay, is a disease that disintegrates the teeth, leaving open lesions or holes. Dentists restore these broken down teeth with restorations. Dental cavities is still the most widespread infectious and chronic disease that people suffer, affecting over 90% of the population of North America. It's the major cause of tooth loss in children and adolescents. So what are cavities? A cavity is an infection or breakdown of your tooth surface. If left untreated, these areas can grow bigger and cause problems such as tooth pain, deeper infection, and tooth loss. What causes cavities? Bacteria in our mouth feed off the sugars we eat and produce acids, and then these acids attack our teeth and cause cavities. What can increase my risk for cavities? Poor dental hygiene, frequent snacking, a sugary diet, and dry mouth. And then the second most common problem is gum disease, which is just as prevalent but affects adults more than children. So this gum disease attacks and destroys your gum and bone that surround your teeth. This disease can be isolated to the immediate area surrounding just one tooth, or it can affect your gums and bones in all of your teeth. Most adults have some form of gum disease, ranging from mild to extensive and severe. What can we do to keep our mouths clean? First, let's talk about toothbrushes. Learning how to brush your teeth properly is the first step to maintaining healthy teeth and gums. By removing food particles, plaque, and tartar from the surfaces of your teeth. Plus, it helps minimize the risk of tooth decay and gum disease, the major causes of tooth loss. You can also use fluoride toothpaste with a soft bristle toothbrush. So these are the two types of toothbrushes. We have a manual one and an electric toothbrush. Do you all use manual toothbrushes? Yeah.
The other one.
Electric one? Yeah. For many, a power toothbrush is the best solution for your oral hygiene needs. These brushes have larger, easy to grasp handles and are excellent for patients with decreased manual dexterity. To brush your teeth correctly, spend at least 2 minutes using a recommended technique, which includes 30 seconds of each quadrant of your mouth, which is the top two sides and the bottom sides. So steps for brushing your teeth properly. Start with your outer and inner surfaces, holding the brush towards the gum line. So these are our teeth. You're gonna angle it towards the gum line and do little circles. And then on the top surfaces, you can just go back and forth. And same again, circles on the inside. We have our little mouth here too. So we're just brushing towards the gum line in little circles. And then once you get to your front teeth, you can hold the brush at more of an angle. Same as the bottom teeth. If you're having problems gripping the toothbrush, you can also put a bicycle handle on the bottom or a tennis ball. Oh, if you're having problems gripping the toothbrush, you could put a bicycle handle on the bottom or a tennis ball. Okay. How to floss properly. You're going to hold the floss between your thumbs and your index fingers. Gently insert the floss, going up and down against each tooth. I have some floss here too. So make sure it hugs each side of the tooth, up and down a few times. These are some additional tools you can use. A Proxa brush. It's like if you have larger spaces between your teeth to get the food out, you can just insert that. And a rubber tip stimulator you can use to massage your gums. Toothpastes and gels containing fluoride are effective in preventing tooth decay and decreasing sensitivity of the gum line. A fluoride rinse or mouthwash can also help prevent cavities. So here we have some products with fluoride in them. We've got the toothpaste and the mouthwash. So I want to talk about dentures next. So you can clean your dentures easily using a soft denture or nail brush. You can attach it to your counter with suction cups. And then you can just run the dentures across the brush to clean them. You don't want to clean dentures with a normal toothbrush and toothpaste, as it can be abrasive and cause damages, leading to an increased chance of bacteria forming and a displeasing look to your dentures. So rinsing regularly, rinse your dentures regularly after eating with warm or cold water. Brush your dentures regularly using a soft bristled toothbrush and a denture cleaning solution. You can remove your dentures every night and soak in warm water and a denture cleaning solution. If it's kept out of moisture or water for a long time, it will become brittle and can warp and chip. If your denture is left out of water for weeks or months, you may find that it no longer fits very well. You may find that it has warped out of shape and is a little bit brittle and is not able to fit correctly inside your mouth. We recommend in this case that you go to your dentist, show them your denture, and decide on the next steps. Why is it essential to have regular dentist appointments? For patients with all of their teeth or some teeth, dentists can check the effectiveness of your oral self-care, take radiographs if necessary, and perform scaling and polishing, and fluoride treatment. Most importantly, it is often a dentist, hygienist, or denturist and not a physician who detects the first signs of oral cancer. With regular appointments, oral cancer can be detected in its earliest stage, when the possibility of successful treatment is highest. It is also important for patients with complete upper and lower dentures to have regular dental checkups in which the fit of their dentures and the condition of their tissues can be examined to ensure that there are no sore spots and that the dentures are functioning properly. I also wanted to talk to you a little bit about the food you're eating. This is the current Canada food guide. It says you should be having plenty of fruits and vegetables, about half your plate. Eating protein foods, choosing to eat whole grain foods, and making water your drink of choice. These are just some suggestions. Cooking more often, eating meals with others, being mindful of your eating habits, being aware of food marketing, using food labels, and limiting foods in high sodium, sugars, or saturated fats. And here's a chart of like acidic foods, very acidic, like that can stain your teeth: wine, sports drinks, soda, iced tea, all the way down to not very acidic, like milk, eggs, carrots, coffee. Yeah, that's all I've got. Want to take a look at these?